Hello, everybody. Welcome to yet another episode of Harsh. I am your host, Chris Myatt Jr., and today we are joined with Dr. Russell Farmer from U of L colon rectal surgery. How you doing, man?
Dude, we are out here living it. I'm having the best time. How are you?
Another day, just another day, man.
Yeah, right.
So, quick question to start us off.
Yeah.
Um, on the show, I've talked about some of the surgeries I had over there at Louisville.
Mhm.
And do you just kind of want to tell the audience, like when we had first met, the bromhidrosis diagnosis, how that came about, and basically the findings that you and your team have found over the course of my handful of surgeries?
Sure, man. So, bromhidrosis can be a really tricky thing to diagnose, and 99% of it is just listening to a patient and kind of understanding and believing. And we can do all sorts of, there's really esoteric tests that people can bring up or do, and it's specialized testing centers that can get these things done for us. But and we can see some things under the microscope, like specific findings, looking for enlarged glands and all this other sort of stuff. But even in the absence of that, like a lot of it's just listening to people and understanding, and you got to believe. And so, part of it's just being a good person and listening and understanding. So I would say that a lot of the time in this diagnosis, you're going to be, you'll be kind of hunting for things and looking for things, and the picture may not always come together super clear, because I would say that the understanding of this disease compared to every other disease we know about is really in its infancy. We don't know much about it. It's kind of just now starting to become something we understand. And so what you end up with is a situation where you're making a diagnosis based almost exclusively on a patient's history. And then, basically what are you trying to do with treatment is you're either trying to minimize the output from these very specialized type of apocrine glands that, make this harsh, foul, evil smelling stuff. And, the there's a lot of different ways to do that. You can ablate them topically, but unfortunately, what it often comes down to, not only in the case of bromhidrosis, but things like hidradenitis and others, is just surgically removing the skin that contains the glands that make the problem. And the reason underlying that is that the options for ablation are not great. I mean, an ablation basically means like you can put chemicals or you can use different kind of techniques surgically to kind of remove the glands from the skin without removing the skin itself. But as long as the skin remains intact, those glands are prone to return, and so it's about trying to you just got to keep working until you remove all that the skin that might be containing the glands that cause the problem. And unfortunately for yourself and for others, the skin happens to be in some particularly sensitive areas, and as you've experienced and others have experienced, those areas and the surgery around them can lead to a lot of particular issues down the line, and it's just about trying to manage those things and get people in good order afterward.
Sweet. Appreciate the response, man.
Mm.
Uh, so another quick question is that book that I gave you, Shattered, Carrie Wilson's book.
Hmm.
She had been clinically diagnosed with TMAU, that trimethylmalaria, malaria, if I'm
Hmm.
pronouncing that correctly.
Hmm.
Um, in her book, you still got it in the
Cool.
office.
Yeah, man. I keep
Uh,
it on my shelf back here in case I gotta pull it out.
Sweet, man.
Hmm.
So the question I had was, in her book, one thing that I found that was a commonality between us is they had given her a topical solution. Remember when I told you that a few dermatologists had gave me that clindamycin pH 1%?
Hmm.
She had had a topical solution similar, and when she had put it on her armpits and some explicit areas that she talks about in the book, I'm not gonna put her business out there. Um, it had created a burning sensation as well. And
Hmm.
anytime I had used those topical solutions, it's like it would work for like 15 minutes or something, and then it would
Hmm.
just wear off, and then people's comments and the symptoms would just begin all over again. So my real question is, in your humble opinion, do you think that there's a connection between things like bromhidrosis, TMAU, and SIBO, things of that nature, like malodorous medical conditions?
Well, sure. So the problem is you have to get to the underlying issue of the symptom. So in things like SIBO and TMAU and all those other sort of issues, is the odor and the symptoms that go along with it, the other symptoms, are they related to bacterial overgrowth, or is it a primary problem with the glands themselves? So we know that oftentimes when you have problems with apocrine glands, that you can overproduce the product of those, which is a very kind of greasy, um, malodorous product. And sometimes what happens is that the odor and the issues are related to that alone, or the issues can be related to the fact that that provides kind of a medium for bacterial overgrowth. And so a topical treatment is really only attempting to treat the bacterial overgrowth part of it and not the underlying issue itself, which is the glandular issue, right? So a
Right.
topical such as clindamycin will kill the bacteria that overgrow as a result of having this increased amount of growth medium present, but it will not address, an antibiotic is not going to stop the secretion of, the chemicals that come out of the apocrine glands. And so you can do something like that until the cows come home, but until you either find a way to use some sort of medicine to change the amount of stuff coming out of those glands or remove the glands themselves, the underlying problem is not going to change. And this is all reinforced by the fact that we see people with a similar condition, which is hidradenitis, where those glands become real, enlarged and inflamed and overproduce that kind of sebaceous material. And then they get real bad bacterial overgrowth and have to have these, large swaths of skin excised in their groins and then their armpits and sometimes the cleft of their butt cheeks, because those skin folds are basically chronically abscessed and infected, which is radically different than bromhidrosis. This is not a chronic infection problem. This is a primary alteration of the chemical process at the molecular/genetic level, and so it just doesn't. It's related, but trying to treat it as you might treat a bacterial overgrowth just ain't gonna get it.
Right. Yeah, I agree with that. As far as testing is concerned, do you think anywhere in the near future, either any doctor or any medical team, because there's people, of course, people want cures, right? We
Mhm.
live in a world where people want cures to everything. They want cures to cancer, AIDS, anything you can think of. People, we you always hear people want to find a cure, and
Mhm.
obviously so. But how do you think someone could go about developing better testing for something such as TMAU, for an example? Because there's plenty of people in the MEBO groups that talk about they took the urine test, but they wonder if there wasn't something faulty in the urine test or uh, something along those lines. Do you how does someone A go about furthering the testing, and B make it almost like more cost effective and more I guess, sensible,
Hmm.
if that's a good term.
Yeah. So, I mean, I think that the underlying answer to that is to kind of alter the testing paradigm that we've kind of undergone to this point. And what I mean by that is to no longer use screening for metabolites in the urine as a primary screening modality, and to move primarily and immediately to baseline genetic testing for the mutation that causes this alteration. And one of the things that we've seen over the recent past, kind of 15, 20 years is a rapid decline in the cost and an increase in the availability of germline, meaning like kind of how you are at baseline genetic testing available to doctors and to patients. And so the thing to advocate for, and the thing that I think, you know, people should ask for going forward, is trying to really understand what the genetic mutations are of bromhidrosis sufferers compared to people that don't have the disease. And then once you're able to really understand what those what the genetic mutation is, it's a relatively straightforward series of tests that is not that should not be horribly expensive at all to get a diagnosis, comparing someone's DNA to someone who doesn't have the condition. And if you come up with a mutation, then they proceed with appropriate treatment. So I think it needs to move away from a metabolic test toward a genetic test. And I think that advocating for that and pursuing that's probably the right way to go.
I hope so, man, because I just gotta say off bat, man, like you're a rarity. The few people that I've talked to on the Meebo, I have a doctor and a team that's backing you that was willing to hear me out, and you guys have made great attempts and went to great lengths to try to figure all this out along with me, so I could have answers and basically to somewhat move forward with my life. There's so many people that they want to get some of those tests done just to rule it out, make sure that A, they don't have TMAU or SIBO or anything like that, but they need a uh what's it called?
Like,
Basically like a PCP, like someone to co-sign to say, hey, a physician needs to say that they would like to have the test done
mhm.
because they won't let a patient or someone who believes that they may have it to just go out of their way to send them an email being like, "Hey, I want to take this test. How much is this going to cost?"
Yeah,
They won't allow them to. They said they always have to talk to a provider.
yeah. And what you're talking about is maybe even a little bit broader kind of issue, which is the democratization of care, into which people should be able to choose the thing that they want when they want it, especially when it comes to making such a life altering diagnosis. And, in reality, unfortunately, people that suffer from this disease have had no choice but to become educated consumers of healthcare, right? So
Yeah,
I would say that you know you're in the upper echelon slash in the elite in terms of knowing and understanding and navigating the healthcare machine system industry complex, whatever you want to call it. And the end result of that is someone who, through that expertise, could readily understand, the nuances and nature of a genetic test about their particular disease, whereas the vast majority of people who get something similar would rely on their physician to help them interpret and understand what to do with that information. And so, in an ideal world, would you be able to solicit those tests on your own and figure out what they mean, and then make appropriate choices? Sure. However, the medical industrial complexes and the insurance companies that either work alongside or work counterproductively toward it are, they're not likely anytime soon to provide you with the capability to make and effectuate those choices. So that's the harsh reality we're living in. But I would love a world where people could make that democratized kind of choice. But it's just not going to happen.
Man, that's unfortunate, but I appreciate the honesty.
Yeah.
Um, another question I'd like to ask is from a fellow sufferer, Letitia Williams. She had wanted me to ask, since you and your team had taken on my case, would you guys be willing to take cases of people who believe that they either have bromhidrosis or TMAU or something like that, and maybe they're located in another state, but maybe
Mhm.
would come
Yeah.
out of state to come see you?
Yeah, man. We're happy to take care of anybody that wants to come, and happy to support people through very difficult diseases. And if you have a problem and you want to be seen by someone that will take you seriously and try to be empathetic to what's going on with you, we're open for business.
Yeah, man.
Happy to see any sick buttholes that are out there, man. We're here.
Well, that's a cheeky way of putting it,
Oh
but
god, yeah, nice.
yeah, yeah, pun intended, I guess.
Totally, completely intended. Right.
But yeah, man, that was a basis of most of my questions. There's nothing else I can really think of at the moment. You pretty well nailed it right on the head. Um, one thing I would like for stuff or anyone listening to hear out. So at some point, could I end up getting a picture of like normal epicnine glands, and then you like show me a picture of mine,
Hmm. Yeah.
like a like microscopically?
Yeah. Let me see what I can do about that, and we can see if we can get like side by side comparative photos, microscopic photos, so that way, maybe we can help out with that for sure. Let me. I'll put that on the to do list.
Okay. But yeah, part of the reason I'm glad that we talked about that because now it just triggered another memory. So part of the reason why I thought possibly I could have had TMAU or something else on top of the bromhidrosis is because even after those surgeries, post surgery, is there still times where I'll have flare ups, like if I get real nervous or if I'm eating a bunch of junk food. And so one of the things that a lot of people's kind of gaining awareness toward is is with these conditions is they can't really eat a lot of processed foods or a lot of fast food, things of that nature, because the added sugar, um, the chemicals it's made with, some of which is illegal, but that's for another topic for another day.
Right.
But basically, that they have better results when they exercise plentiful and basically eat clean. Uh, so part of the thing that I thought is, what if bromhidrosis and TMAU were just closely related, or is either the same thing and one was either a symptom of the other one?
Yeah. I mean, I don't know. I don't think we know the answer to that question yet, but I would posit that everything you said certainly supports the the apocrine adenopathy problem that you referenced. So, what you're describing is um, consistent with people who have that sort of an issue. So, the increased intake of fats, lack of appropriate exercise, all of those things are going to be contributory, um, you know, to those type of outcomes. And so, it goes, it almost always goes without saying, take care of yourself, and your body will take care of you or whatever. So,
Right. All right, man. Well, that pretty much wraps this up. Do you want to give yourself a shout out? Tell people what phone number they could reach out to you guys at, or websites,
sure, yeah,
anything?
you can look me up by my first and last name, Rustin Farmer, uflhealth.org, or you can always call 502-583-8303, and we'll get you in and squared away, man.
All right, man. Thank you so much for your time, Dr. Farmer. Hope you
You're the
guys
best,
have a
bud.
good day, man. I'll
Yeah, you
talk to
too.
you later.
Talk to
All
you
right.
later. Bye.
Bye.